Sleep disorders usually come together with heart failure patients, but even if the patient doesn't have a sleep disorder, a BiPAP or CPAP may still benefit the patient because this is how it works. When you put someone on a BiPAP or a CPAP, that means this will blow air into the patient's airway, correct? It won't give a breath, but it will blow air, correct? Air pressure. Is that normal for our physiology? No, because the pressure, let me illustrate real quick. Okay, look at this. So normally when we breathe, let's say this is zero pressure. When we breathe, the pressure at the end of exhalation goes to zero. So if this is zero pressure, and let's say this is Miss Hadia, he takes in a breath. Okay, so that is like that. So the pressure at the end of exhalation goes to zero. And she takes another breath. Okay, zero pressure. Now, when we put BiPAP or CPAP, since those things blow air pressure nonstop, well, a CPAP nonstop, BiPAP, it blows higher pressure at the end of exhalation. This is what's going to happen. She still takes a breath normally, but then her end expiratory pressure does not go to zero because there is BiPAP or CPAP. All right, because it's blowing. So therefore, if it's zero, that means the pressure in the lungs are zero at the end of exhalation. So therefore, is there gas exchange during exhalation? No, because the pressure is zero. Okay, you have to exert pressure in order for gas exchange to occur. Here, she's now having a CPAP or BiPAP exerting pressure at the end of exhalation. So is gas exchange still occurring here? Yes. Plus, what happens to venous return? Because normally, if this is your heart, you have the lungs on each side. At the peak of airway pressure, at the peak of inspiration, what's happening to the heart when both lungs are hyperinflated? What's happening to the heart? So let's say I take a breath, right? So what are my two lungs doing to my heart? Okay, so what happens to venous return during this period? Because I'm pushing the heart, right? But that's fine because it's only for a moment, right? Just a moment. But then once the patient exhales, the heart re-expands and then venous return increases. However, if you put BiPAP or CPAP, what happens to the pressure here? It's higher. However, as long as it's only, let's say, 5 centimeters here, 5 centimeters of water, it will not affect cardiac output, okay? Because venous return will drop once you add CPAP or BiPAP, okay? But as long as it's only 5 or less, it won't affect cardiac output. However, did you did you decrease preload? Now remember, you put the patient on BiPAP. Therefore, the pressure remain high, yes, for an extended period of time, correct? So, yes. So what happened to venous return?
It decreases.
Decreases. So therefore, the preload decreases. Yes, a little bit. Okay, so does it benefit the heart failure patient? Yes. Plus, again, most heart failure patients have sleep apnea. So you have two benefits there. So you're improving sleep, plus you're also improving cardiac output by decreasing venous return a little bit. Okay. We'll skip the procedural and surgical interventions. So these are now, because these patients will only be seen with these devices in the ICU. And remember, there's no ICU question on the NCLEX. Okay. So the intra-aortic balloon, ventricular assist devices, we'll skip that. That's it for heart failure. Oh, the teaching, sorry, I forgot. So we have a acronym for discharge teaching. No, 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 no. Let's not stop smoking. Signs and symptoms. Signs and symptoms to report. Medications, you have table 25 dash what? Dash something, right? Okay, so we have the diuretics all the way down to digoxin. Okay. Then activity. Activity here, of course, you have to balance activity with rest. Walking would be your best activity. Weight, so daily weight, correct? And how do we weigh again from fundamentals? Same scale, same time. Okay, same patient, right? Same time. Okay. Diet, of course, is the sodium. Okay, low sodium diet. Okay, let's go to signs and symptoms. Now, are you going to report acute or chronic symptoms? Okay, because if you report chronic, what is the doctor going to say? Yeah, you have heart failure. Okay, but acute, of course, you will be told, okay, come here, come to the ER right away, or maybe come to the clinic. All right. We monitor, of course, these patients have to attend their regular appointments with the doctor. Usually they get a they give a urine sample at every visit because microalbuminuria, meaning the presence of proteins, albumin in the urine, is an early indication of that the patient will go into exacerbation soon. In addition to BNP, because the BNP, unlike unlike BNP, wherein when the BNP is high, what's already happening? Is the patient already in failure? Yeah. It's too late. However, protein in the urine indicates kidney injury, which is an earlier sign that the patient's cardiac output has it been normal? No, the cardiac output has been dropping, and then that, of course, will lead to acute kidney injury. All right. So that's an earlier sign, microalbuminuria. BNP, too late. Once the BNP is elevated, that means you're already in failure. Yeah, the walls have already been stretching. What else? Yeah, so acute shortness of breath. What about increase in edema more than usual? Yes, you report that because it's out of the ordinary. And that's it for heart failure. Okay, we still have time for, let's do